Hi, Dr. Ramsey Choucair, plastic surgeon in Dallas, Texas, here to continue our educational series on different subjects in cosmetic plastic surgery. Today we're going to talk a little bit more about male facial cosmetic surgery. Patients who come in for rejuvenation of their face all expect a certain improvement. And in the male population, the expectation is even more important to discuss. Primarily because most of us men are not very good patients. I can say that, and I think I can freely say that, at least in my practice. They're not bad patients. They just don't put up with some of the things that the female counterparts put up with. Maybe it's desire, maybe it's just that they're moving on to the next thing more quickly. But nevertheless, when we deal with male patients, I'm very cautious about making sure that the expectations are clear. One example is, in many men, as opposed to some women, the neck that we improve, which many men come in for, is a relaxing neck. There's usually no fat in the neck in most men. It's not a complete, statement, but many times men don't have as much fat. They just have the muscle and the skin relax. And no matter how hard we work on that neck to pull it back and make it look as good as possible, men's skin is a little looser and it has a little more elasticity, and so a little less elasticity tends to stretch. So 6 months later, sometimes men will come in and go, I know I'm better, but it's starting to loosen again. So the important thing in men is to let them know that can happen no matter how well we do the surgery. In fact, we're real clear with most patients, especially men, that we're doing everything that's known to legitimately, predictably make this look better, but there's limitations on the reality of the skin and how it relaxes. So that's one thing for men. The second thing we tell men with any kind of facelift or neck lift is that if they have a dark beard or a beard that's noticeable, when you pull the skin even in the correct direction upwards and back, the beard will be pulled back closer to the ear, and the hair that's here could be pulled behind the ear. So fortunately, we have an opportunity many times to do laser hair removal, because that's one of the things that I look for in men who've had facelifts. If the hair is growing near the ear or behind the ear, you know that's not normal. So one of our estheticians who does laser hair removal can usually help that if it's dark hair. If it's not dark hair, if it's lighter or gray hair, then we typically go to electrolysis. So those are two things in male facelifts that we discuss very clearly. The shift of the hair, even though the skin is shifted correctly so they don't look unusual, nevertheless you're moving skin that has hair back and over. Second, we make sure that no matter what we do in the neck, as good as we know what we're doing will work, there will be some relaxation, and it's important to let them know that. So those are the two things in men that we commonly talk about with facelifts.